Hello, everyone, and welcome to another episode of Beyond the Superficial. We are chiropractors and functional medicine practitioners at Synapse Center for Health and Healing, located in Eagan, Minnesota. Information shared in this podcast is not intended to diagnose or treat any medical conditions. Please consult with a primary care provider before engaging in any new activity or protocol. With that in mind, let's dive into this episode.
To another session of Synapse Beyond the Superficial. My name is Dr. Amber Janetsky. I'm a chiropractor here at Synapse. I also do functional neurology and acupuncture and functional medicine. Ellie.
My name is Ellie. I'm the trauma practitioner and somatic coach and do anything involved with emotional, mental health, as well as stress management.
And I'm Dr. Ashley, functional medicine practitioner and chiro as well.
Well, welcome. Today we're going to be talking about sleep and sleep hygiene, how to get better sleep. We are doing part of a series here of just challenging people weekly on one thing to better your health. And so this week we're going to give you a challenge regarding sleep, and we'll give that at the end. But we're just going to kind of dive in and start talking about how can you improve your sleep and hopefully get better rest. All right. So maybe we should start with just good sleep hygiene.
Yeah.
How that goes. I'll just dive in. The first thing is just keeping a good circadian rhythm and going to bed at the same time every day, waking up at the same time every day. Mm-hmm. That can be a big help instead of kind of having your circadian rhythm work for you.
Mm-hmm. Like weekends. Weekends are tough.
Yeah.
To keep that the same.
Keeping it the same.
And traveling, of course.
Yes.
But
yes.
Weekends are tough.
Yeah. I was just listening to another podcast by another provider talking about don't force your circadian rhythm either. You know, this topic is really good for me because I'm going to need this challenge this week. I really haven't slept good in the last 5 years since I've given birth. My daughter just was a bad sleeper, and she literally woke up every 45 minutes to 2 hours for the first 8 months of her life.
Oh my gosh.
And then not until this last year, when she's about 5, has she slept through the night. And then lucky me, I'm also entering perimenopause, so my hormones are dropping, and sleep just really sucks, to be honest. So I'm really excited to kind of dive into this week, this topic, and kind of clean up my own sleep habits. And this podcaster was also talking about if you wake up at 4:30 in the morning, maybe that's just when you want to wake up. So maybe go to bed earlier. And I've been trying that. I've been going to bed more at 9, waking up more at 4:30, and that just has been working a lot better. I know so many of my patients say they wake up at a certain time and then they try and go back to sleep. And, if it's 2 or 3 in the morning, yeah, that's different. But if you're waking up at 4 and 5, that's not so bad. Maybe that's just when you want to wake up and kind of go to bed earlier. I know it's hard as a parent. You want that time to yourself at the end. But, if your sleep is really suffering, at least maybe for a while, kind of working with that natural rhythm would be good too.
Mm-hmm.
Yeah.
Yeah. Did you already mention getting morning sunlight?
No, go ahead.
Oh, well, it's so important for us. I know it can be tough with blackout curtains and everything and kind of that dirty light coming in, but it can be really helpful to get natural sunlight coming into the room too, to kind of slowly wake you up, that process too, which can help regulate things. I know there's even different alarm lamps out there that kind of slowly, so that our eyes can recognize that sunlight, because even if our eyes are closed, we can still sense that sunlight with our eyelids closed or through the eyelids. It just kind of slowly wakes up that cortisol response. But morning sunlight, get up, don't look directly in the sun, but look into the sky or take a little walk, just, pop outside for a little bit if you can.
Mm-hmm. Yes. I mean, I do that. I go out on my porch, even if it's 1 minute, 2 minutes, that's better than nothing. Yeah. And I think they recommend maybe 5 to 10 minutes outside, but it's just that blue light coming in really starts to work with your circadian rhythm and wakes you up. In the wintertime, I use a Verilux light. It's just a natural sun lamp. You're supposed to sit at least 10, 12 inches from your face from it for about 30 minutes. But you know what? I just put it on for the whole family to kind of experience in the morning. And I really do think it makes a positive impact.
Yeah.
Just having that on. Yeah.
Mm-hmm. Yeah. And kind of the opposite of that too, at night, we're supposed to be winding down, start to dim the lights, like you were saying. Don't be looking at a blaring TV or your screen, your phone screen.
Yeah.
That'll throw things off too.
Yes, it's actually going to be our challenge this week, which I'll reiterate later, is that cutting screen time off at least an hour, even more, before bedtime. You can change the TV screens and on your phone screen to different settings, and there's different apps that can remove some of the blue lights from that coming in. But, even with that, I feel like it's not good enough. Like you kind of mentioned, cutting dimming lights, shutting off the overhead lights, can be a really big help in helping that circadian rhythm calm down a little bit.
Even using candles for your light.
Yeah.
Like,
Really relaxing.
Yeah.
Get some of the
Less
elements
artificial.
in there.
Yeah.
Yeah, that's really important.
In my room I have like a salt lamp that has more of a red pink hue, and that's what we turn on in the bedroom when we're going to bed. You know, and try to dim everything else out just so that we can naturally come down and get a little bit more tired, and because everything we're talking about is directly connected to cortisol, right? And so how can I actually bring down the cortisol, whether it's through light, less screens, less noise, and get my body to calm down enough so that it can now get into that rest and digest, as opposed to amping up and getting ready to do things.
Yeah, and that kind of speaks to just eliminating stressors, period. And so, like, electromagnetic frequencies is a stressor on the body. And so that's another thing that we recommend, is just removing those electronics from the bedroom. You can put your TV, other things on a power strip and just cut that power strip. That's an easy way, so you don't have to reach behind and plug it in, unplug it. Because even if you have it plugged in, you're still having that electricity pull. And so it's not enough just to turn it off. I mean, that helps, definitely. Not having your phone in the room whenever possible. Putting on airplane mode, but I don't think that even works anymore. I think there's still coming in. You can get screens, different covers for your electronics too, that help eliminate some of the electromagnetic frequencies coming in. A lot of people turn off their Wi-Fi at night to eliminate that as well. And so you could add that to the challenge this week, and you'll even get better results. So no screen time before bed, but also remove those electronics. That'd be awesome.
Well said.
Yeah. One other thing to think about as stressors is toxin elimination in the bedroom. Maybe this isn't really thought about, but like, what are you sleeping on? And what's the airflow going on? And so you can kind of get even more into, like, what's your mattress? Is it an organic mattress? Are there flame retardants in it? That kind of thing. Organic mattress sheets, dust mites in the room, making sure that your bedroom is clean. I use an air doctor filter. I think that really helps eliminate some of that stressor, because if your body is just feeling stressed from having to fight all these toxins all the time, a lot harder to get into that rest and digest mode that you were talking about.
Yeah, even with pillows too. Like a cheaper pillow you're supposed to replace every 6 months, and more of your like high quality, more expensive pillows still supposed to replace them every year. So
I've always been curious about this, because I mean, they've said gross statistics of like how much body, like skin is like in
and
the pillows after a certain amount of time. But like, I wash my pillows, and I'm wondering if like, does that good enough or not? I'll have to look into that.
I'm not sure, but I've seen those pictures of those little dust mites and their little eyes and heads, and like, absolutely not. No, thank you.
No, thank you. Yeah, so that's another thing that you can get picky about if you want to.
It makes me think of even dusting under the bed, right? You might have everything organic and pure and the best linens, but are we actually dusting the room and dusting under the bed and really keeping it a clean environment? Because there's only so much that these filters, can clean up.
Can do,
And so how can we support that?
Yes.
I'm definitely going to check my bed
Under the bed. Yes.
It hasn't been seen in probably a couple of years.
Yeah. Well, we had a patient that wasn't sleeping, and we were having this conversation during a red flag meeting, and Dr. Troy brought up a patient that once they dusted and cleaned out the dust mites, like that was the thing that really helped them get into sleep. Dust mites are one of the bigger allergen causers to people, and so something to think about.
Yeah, and even someone, they had like a mold or like air quality testing done, and it was worse with a room that they kept a lot of like papers and like documents, so they got rid of all that and dramatically improved like air quality.
Feel better. Less stress. Absolutely. Also, the bedroom is meant for sleep. So again, not having TV, that kind of thing. Even reading, that's going to be a nice thing to kind of replace TV if you're doing it, but maybe consider sleep or reading in the living room. And then when it's time to go to bed, it's time to go to bed, because that it just helps your brain kind of associate the bedroom with sleep. Yep. What are you guys going to replace? Do you guys watch TV before bed?
Not usually,
Nice.
honestly. Yeah.
Good for you.
But I
What
do
did you
read.
Okay.
I do read, because we have the red light, like a red light thing where I read in bed, though. So that's one thing I could be better at.
Okay.
And keeping my phone farther away from the bed, too.
Yes.
Because, like, if you wake up in the middle of the night, you just want to, like, oh, I'm so tired, or, like, I want to fall asleep, so, like, you'll put a podcast on or something. Like, no, I need to be better about that.
Yeah.
Just go back to bed.
That's something that I've had to learn, right? If I'm not sleeping through the night, just get myself out of the room.
Yeah.
Instead of trying to force myself to fall asleep, try to exhaust yourself somewhere else so that your mind doesn't correlate the two of, your bedroom is where you also live life as opposed to just rest and sleep.
Yeah.
But I think a big one for me was just recognizing with exercise, right, timing it enough so that I'm not spiking that cortisol, getting my body revved up, and then trying to fall asleep and trying to figure out why I can't fall asleep. Or the opposite, doing really early morning workouts, learning for females and just for, where I was at, it wasn't good for my cortisol, it wasn't good for my hormones, and so spacing it out just right so that I'm getting the benefits of exercise but not hurting my sleep from it. Is something that I've been kind of working through here.
Yeah, because when you exercise, you release cortisol, and so that affects that circadian rhythm. And so, we usually tell our patients, that morning time, like you were saying, finding that right time for you, but better more towards the morning time to do your big exercises.
Yeah, because you usually want to work with a cortisol spike, which is typically an hour after you wake up. So when cortisol is the highest, so if you can.
That's a good time. Yeah. A little trick that you can try is if you do wake up in the middle of the night is something called uniplanar hand movements. So you can kind of think about it as kind of petting a cat. So it's very slow and one plane. So you're not going like this. You're doing it really slow. It's kind of like the same thing as rocking in a rocking chair. It's so boring that your cerebellum says, I don't need to be here for this. I can check out, and it kind of gets you into that sleep mode. For me, when I do it, I have to do it for about 1 or 2 minutes, and then it doesn't exactly like right away put me to sleep, but I can definitely feel that I'm like more in that sleep brainwave, and that can be really helpful too.
You do that while you're in bed?
Yeah. If I just wake up, I'm having trouble falling asleep, just nice and slow.
One thing I was gonna bring up too, usually I work out in the evening. That's when my schedule allows, and I don't want to wake up at 5 a.m. to work out. So like I kind of supplement my bad lifestyle of working out late at night. We'll sometimes do phosphatidylserine, about 400 milligrams before I work out. So it's going to prevent that big cortisol spike too. If you have to work out in the evening, you can kind of do some things to mitigate the effects.
Yeah. Well, maybe we should take that to step into talking about food before eating, or not eating, food before bed, before sleeping. This one is, I have differing opinions, and I usually say you have to figure out what works for you, because technically when you eat food, you're going to release cortisol as well. You're also going to wake up the digestive system, and that is the reason why sometimes people can't sleep, is because that's busy working and it's not resting. And so oftentimes people will say, you shouldn't eat close to bedtime, and that helps. Do you guys have an opinion or thought?
Kind of same thing, where like it depends on the person too. Because I have people where like blood sugar will drop too much during the evening. Right. So sometimes it can help, doing a little bit of like blueberries or something to help secrete that have carbohydrates secrete serotonin to make it, which controls that last half of the sleep. And so some people do really well with that, so they can carry on the sleep cycle. But yeah, not for everyone, kind of case by case basis.
Yeah, I know for me, I've talked about in other podcasts, is that I do better with a little snack before bed. I think it is because my blood sugar likes to drop a little bit, and when you're hungry, your brain wakes up and looking for food. This is the same thing as we get older. We have a harder time using glucose for fuel for the brain, and so that's where like ketogenic diets sometimes work. People get that ketone, and that'll help them sleep through the night better too. Same thing with if there's been a history of concussion. The brain isn't using the glucose as good, and so ketogenic diet can sometimes help in concussion patients get that sleep going throughout the night too, because you're getting fuel to the brain and it's fed throughout the night.
Yeah. And I guess based off supplementation too, like usually people are having a hard time falling asleep too, try these these different things first, but sometimes melatonin can be helpful. I like to use liposomal sleep from Nutridyne because it has the L-theanine, the I think passion flower in there, and a little bit of melatonin. Because it's been proved over and over in research too, where melatonin supplementation doesn't suppress our own production of melatonin. So it's such a good antioxidant too. So. Never hurt to try it either. It's not gonna cause issues.
Definitely doesn't hurt. Some people don't do well with melatonin, and that's where you just have to try. Some people do great. Some people, like when I take it, I wake up after 4 hours. Some people have really vivid like nightmares on it. But if it doesn't work for you, there's, like you mentioned, there's other things like L-theanine, valerian root, passion flower. Those are some natural things. Magnesium, great things to help as well. If melatonin doesn't work.
I heard this one provider talk about melatonin use and with the bad dreams. Yeah. And they said if you can push through that for 4 nights, 3 or 4 nights, and it'll go away. Because essentially it's the regulation or the deep sleep you get into quicker. So
maybe I'm just not used to it. Maybe I'm not used to the deep sleep and I'm fighting it.
I
want it. I'll have to try it longer.
Give it a few days.
I did find out genetic testing. I have genes that are not conducive to deep sleep. I found it on my 23andMe DNA.
Interesting.
It is interesting. Great.
Is that something you can bypass or
I don't
hack,
know.
if you will?
23andMe isn't great. I've never done looked at what gene it is. I've just done their report, so I don't know which gene it is specifically to look at what coenzyme or enzyme or vitamin can help support that pathway. That'd be a good thing to check out.
Biohack it.
That's something I'm really actually passionate about with when clients come into me to see me and I'm not sleeping, I'm stressed. Right? Sometimes I won't even start with the trauma and the stress. We'll start with how can we support your system so that we can heal. Because if you're overwhelmed, you're in survival, we can't heal. And so talking to a lot more clients about genetic testing, seeing if, specifically COMT, is that a lot of people with that tend to not be able to fall asleep, or they have cortisol is just kind of circulating through their system.
They have a harder time detoxing dopamine and things like that.
So they could be trying everything, but it's actually we need some additional support from the inside. And that can look like supplementing with different adaptogens or just finding the right fit. Some other people, and this is where an assessment is so good of, are you waking up at 2 a.m. because your blood sugar is spiking? Are you waking up at 2 a.m. because of hormones? Are you actually too hot and we need to change the fibers or bring down your temperature by supplementing some things like Schisandra or other kind of herbs just to kind of help your body actually fall asleep. Sometimes it's not all mental, sometimes it is. And so whenever it's sleep with a lot of my clients, we talk a little bit more about how can we supplement or what else can we add in so that your body can relax and rest, and then we can continue to heal from the inside out, whether it's emotional or hormones or something else.
You bring up a good point is I've had other providers talk to me about, one way to explain it would be like a worry jar or a worry cabinet is to put those worries into a jar, pretend jar. You could even write it down and put it in a real jar. Put the lid on and say, I'll open you in the morning. And it really does help. But do you have any other recommendations that you give patients along those lines? Like, how do I stop thinking about my worries for the day?
Yeah, often when I have that, something that's been really successful is it's actually a need for co-regulation, right? We're trying to process something in our mind, but it can be hard on us because we actually need someone else to support us through it. So we're trying to solve it, and so sometimes something that can be really soothing is just touch, right? Asking if you have a partner, hey, can we hold hands before bed? Or can you rub my back? Or learning some techniques where somatically our body feels like, even though we're giving ourselves the hug, right, our body is actually registering, I'm receiving support.
Yeah.
And so using our body to co-regulate or even self-regulate so that our mind can stop looking for these cues of I'm all alone, or whatever the deeper trigger is, depending on childhood, past traumas, past experiences. So that co-regulation piece can be really important, and that's where there's a lot of conversations that I'll have about that skin to skin, how very often as babies, we talk about how that's bonding and that provides more security, and how we actually still need that in adulthood. It's that same correlation with oxytocin, right, brings down cortisol, so then we can naturally fall asleep.
Yep.
So finding different things that can boost oxytocin before sleep to kind of switch the brain. Because especially with women going through hormone changes, right, our insula is, it's already louder for women, it's bigger, it's the worry center, so it's already kind of constantly worrying. And then if our hormones are out of whack, that's even more triggered. So just being really careful or mindful about having some more co-regulation throughout the day.
Yeah.
I think that's helpful.
That'd be weighted blankets, I suppose, would be helpful because that goes from a neurological standpoint. When you are stimulating the proprioceptors in your skin, like you're talking about the touch and having that weight on there, you just stimulate those proprioceptors, and that actually pumps up your frontal lobes a little bit. But those frontal lobes, when they're healthy, they're controlling those limbic system areas and just helping things calm down a little bit. So that would be another thing that you could try. Yeah.
Good idea.
There are things too that, like things that are warm or even have a heartbeat. That are for kids, but I don't see where adults can use them as well. Just to have that kind of stimulation there.
Cool.
Yeah. Let's see if there's anything else. Do you guys have any other things to bring up?
Yeah, I guess one thing from like a structural standpoint, like sort of chiropractors who look at this, I always like to ask, do you have any chronic sinus issues, or have you had a sleep study done? Because a lot of times when that oxygen is dropping throughout the night for various reasons, you're not going to get into that deep sleep or restorative sleep. So I always like to look at jaw, make sure jaw is functioning. So whether that be muscle work or adjusting the occiput, that can play a huge role in sleep apnea. It can even, help it, reverse it. Or else sometimes I'll just have people do a watch pat here that we offer to see if that oxygen is dropping, or if, pick up if you're snoring or not. So like what positional, like simple things can we do? Because I like to use a combination of nasal tape and then mouth tape too. Because that mouth tape will help bring that jaw forward and open up that airway a bit better. And then I like to combo it with the nasal strip too, just to have an open airway too. Just get some good restorative sleep. Just fixing a few structural things and ruling out like chronic sinus issues like mark-ons and things like that, preventing airway.
Yeah, so people, if you're interested in doing that, you can call the clinic. We do the watch pet test and the mark-on swab here. No, thank you for bringing that up, because even from a chiropractic standpoint, if you have a low level of pain, even if it's not registering in your brain, that pain is going to be increasing your cortisol level, right? And that makes it harder to sleep. So even just getting your body in alignment, getting your muscles worked on, can just help that you feel more calm with that. And you brought up the jaw. There's actually just a really cool neurological connection with the cranial nerves that innervate the jaw. They go back into your midbrain. And that's, so anxiety and the jaw are really tied together. And that's why when you're stressed, you start to grind your teeth at night. And so a couple things, doing meditation, prayer, those are like bicep curls for your frontal lobes. And that's one way to stop grinding your teeth at night, is if you start incorporating that. Also, just talking to your dentist or even getting an over-the-counter mouth guard can really help kind of take that stress off of the jaw too, and improve some sleep with that too.
Yeah, there's even a lot of exercise you can do too to strengthen the back of the tongue. Because that when you sleep, that tongue should be like suctioned up and up to the roof of the mouth. So there's different exercise you can do. Like one of them is like balancing a spoon or moving a spoon up and down. It's like having like the bowl part of the soup here and then balancing it with your mouth up and down.
Wait a minute, what do you mean? Like,
So
where's
like,
the...
Like if you have your spoon like this, yeah, and you like move it with your mouth.
The handle's in your mouth.
The handle's in your mouth.
Okay.
Yeah,
You're
and
lifting
you-
it up and down.
Yeah, up and
Okay.
down because it'll strengthen all the muscles underneath the jaw.
Okay. Interesting.
Yeah, so simple when that comes to
Another
mind.
good point you bring up is tongue tie, getting
Oh,
assessed
yeah.
for that. I mean, there's so many adults that, because I know to look for it, that come in and a lot of things, like they have so much tension in their neck and their jaw and everywhere, everything that can affect airway
Yeah.
and sleeping at night. And they have this horrible tongue tie that was missed when they were an infant.
Yeah, and anxiety with it.
Yeah, anxiety,
'Cause the-
weight gain,
Yep.
causes of sleep apnea, wetting the bed, so many issues because of that missed tongue tie. So I actually, just found it on a friend of mine. Gosh, she just was so tight in her neck and upper back, and I was like, let me see your tongue, like let's see. And she definitely had one of the worst tongue ties I had ever seen, and she just went and got it reversed.
Is there a way to self-assess it, like in the mirror?
You can, if you open your mouth, I have people open their mouth all the way and try and touch the tongue to the roof of the mouth. And if it's just so short, it's obvious. Yeah. And if it's not as obvious, it's hard to then self-diagnose because you can have a subtle one that sometimes just needs physical therapy, like you're talking about, or stretching. But if it's really, really short, then a revision might be a benefit. That one's pretty obvious. Like it's like, or if you can't stick your tongue out,
Oh, yeah.
like very far, that could be a sign too. But better to have someone who knows looking. And even just typical dentists oftentimes don't know how to assess for tongue ties. So sometimes going to a biological dentist or someone who specializes in it would be a better way to catch it. Yeah. So if your mom said you have problems latching or breastfeeding, that's a good sign too that there might have been a problem that was missed.
Yeah.
Yeah. From my standpoint, I love that we're talking about the jaw. I do a lot of jaw work from an emotional level because the jaw, think about anger or when we suppress something, right? Our body, our nervous system tried to push it out, but we didn't feel safe enough to express it, so we swallowed it back up. I know that was a lot of my work too, of just realizing so often I would clench my jaw and it was so tight. And even from the outside, people would recognize it of, oh, you're a little stoic or you're mad. And I would respond back with, well, no, I'm not.
Yeah.
And so even suppressing it for myself for a really long time, not realizing I was swallowing so many things that I needed to express that my nervous system was trying to get me to express, but there was no safety. And so doing the deeper work of where am I stuffing emotions, where am I even hiding from myself or hiding from others, and then doing the work of letting it come up. So that our nervous system can be able to, express, regulate, and then decompress, and learning the safety of that, as opposed to swallowing, suppressing, compartmentalizing, pretending it's not there, and then wondering why we can't sleep because we've just swallowed so many things that we've wanted to say, or maybe we feel like we can't or we don't even want to. We can be scared of our own anger. That's something I see very, very common, right? What is your relationship with anger? How was it experienced for you in childhood? And do you feel safe enough to express it without aiming it towards others and causing harm? What do we do with anger, right? And for a lot of people, that pattern is, again, just internalizing it. So it can come up as guilt or a lot of apathy. I feel more depressed.
Shut down.
I feel more shut down. I'm more sad. I'm just crying for no reason without realizing that that's probably a lot of anger that we've stuffed down, and now we can't sleep. Now we're having issues here. Our whole body's actually trying to self-preserve and get tense and curl in, and of course we can't sleep now.
Yeah. And that's where, again, from the neurological standpoint, is even moving those areas of the body when you're noticing that tension. Like maybe you're thinking about those things that make you angry, and you first of all, like bringing attention to where am I feeling it, and then moving it too. So addressing it emotionally with a provider or a spiritual or whatever you want to do, but then moving that area of body to move it out. And that's where the vagus nerve work comes in too to help us sleep, is doing some breath work, moving the diaphragm, gargling, singing, humming. All of those things can move this area, like you're talking about, gets stuck right there, can help move it out and also stimulate that vagus nerve. ear massage right in the ear can also stimulate vagus nerve. Those are some ways to just help with that, getting in that rest and digest for sleep too. Yeah.
Have you seen the straws that they make to, I guess, like to activate the jaw or like the back of the tongue?
Yes. Is it?
I want one of
They're
those.
called
I forgot to.
Mayo or something. Yeah.
But they're special like shaped straws to like
Yes.
also strengthen the back of the tongue. But
Yeah. Yeah.
that's cool.
No, it'd all be good. One more thing I'd like to bring up is just hormones. So female hormones. Big reason for people not to be sleeping, and not just female hormones, I shouldn't say that. Men have problems with it too. If progesterone is a big one that will start to drop, especially in that early perimenopause, or even as men get older, that starts to drop. And progesterone is one of the hormones that can actually stimulate some of the GABA receptors and help you get into a relaxed state. And so one of the biggest things that we can do here in our clinic with our providers here is to be doing some prescription over, progesterone, and lots of people get good sleep results with that if that's one of the cause that's causing the poor sleep.
Yeah,
So.
I've even gotten good results too. It's just like the wild yam, progesterone based one too, the plant based ones too.
Yeah.
Yeah, really helpful.
Yeah, so kind of thinking about that would be a good idea. So just some things we're gonna, unless do you guys have anything else that you wanna
I don't think so.
bring up?
Do you?
Okay.
Yeah, I was just going to add that, I mean, we already touched on it, but yeah, I probably mentioned this earlier as well, but just the importance of doing both the physiological and the psychological. And so blending that too, and looking into some other supplements like ashwagandha, especially if it's hormone related. I'll often recommend that for my population that I'm working with, or some other things to drop cortisol during the day, like rhodiola or Ulithro, or even drinking holy basil Tulsi tea, or taking something like that just to help supplement and support your body, so that we're not just working on sleep. Sometimes it's actually what happened during the day. And offloading some of that, because if we've been running on fight or flight all day, of course our body's not going to just shut off and turn on the brake, right? We need to learn to get used to turning on the brake. Or for some people, they have a gas pedal on the brake and on the gas at the same time, right? So of course we're not going to be able to fall asleep, and kind of retraining our nervous system from the inside out, supporting that.
Yeah, no, it's great. Yeah. And that will kind of lead into, so the challenge for the week is let's take screens and screen time out of the bedroom, eliminate it for 1 hour before bed. That would be just a great challenge. Let us know how it goes. So some things that maybe you can do instead is, and as I think about this, because you know what, like I said, I'm a single mom. I don't have time to myself until bedtime hits, and I want to just veg out and watch TV. So this is actually going to be a really hard challenge for me, but I think it's going to be so good and it's so needed. And I'm excited to report back on what changes happen and how I'm feeling. And where it goes from there. So a couple of things you can do is, one, get to know your spouse a little bit better. Have some talking time. Reading a book, doing some prayer and meditation. Those are, like you talked about, like it's going to connect to that mental health. It's going to help you get down into that rest and digest mode. You'll probably just conk out, fall asleep while you're doing it. So yeah.
We've been playing Monopoly Go. Monopoly Deal. Monopoly Deal.
Awesome. Yeah.
The card game. That's been fun.
Good connection time.
Before bed. Yeah.
I love it. Yeah, something like that. Those are good. Journaling. That's another place where you can put your worries and close the book when you're done. Also, just a great way to just like reflect on the day, writing down some of your goals, that kind of thing. But
another thing that I've incorporated, me and my husband we've gotten really into the like medicinal tea game. And so getting some medicinal teas that help your nervous system, but also it's just such a soothing routine. Having your cup of tea and either reading or, connecting with your partner, or sometimes I'll just kind of finish out the tasks for the day, whatever it is. Even if we're having company over, right, we'll offer some tea, just because it's such a part of our routine now, and supporting ourselves again with some of the added benefits of the herbs, but then just the ritual. Just like a lot of people have that coffee ritual. So morning. Having that already kind of, now that we've done it enough times, my mind kind of already knows, all right, I'm going to bed soon.
Yeah.
And just kind of calm me down.
Yeah.
Yeah. Do you have any sources of good tea?
There is a
Regulators?
brand that I really love, and I can't think of the name right now.
Okay.
I will have to get back. But yeah, anything that's organic, naturally sourced, right? The closer it is to home. This one is made in, it's grown in Wisconsin somewhere.
Yeah.
Sweet.
And just blending the right amount of, things that will actually calm you down.
Yeah. I know I go to some co-ops in the bulk. They have some really great tea leaves that you can just put in your own either little whatever you call it, little packet, or the little strainers, or doing it even a French press. Yeah, and the quality matters. Like you can get some really good tasting and enjoyable teas. Yeah.
Quality, and then I also you probably already knew this, but I learned that the medicinal properties are in the steam. So making sure you're actually doing it in like a French press, putting a cup over your tea as it's steaming.
I did not
to
know
really
that.
absorb all of the medicinal properties as much as possible.
Love
Yeah.
it. Okay, cool.
Yeah.
Great. All right, anything else, ladies?
I think I'm good.
All right, well, thank you for joining us for another episode. We'll be just touching bases over our social media during the week while we are also doing this challenge. And so just chime in, let us know how it's going. And next week, we'll be back with another challenge. Thank you.
Sweet dreams.
Yeah.
That concludes today's episode of Beyond the Superficial. Thank you for joining us, and stay tuned for more episodes. For more information, please visit our website, www.officialsynapse.com, your partners in healthy living for optimal life. We would love to hear from you on how our podcast might be impacting your life. We also want to hear what interests you. Please leave your feedback on our media page at www.officialsynapse.com. Thanks again for listening, and we'll catch you in the next episode.